Hi everyone, this is Dr. Demetrios, Kydonieus, chiropractic nutritionist, and today I am here interviewing Ann Brown, one of my wonderful patients, and she originally came to me quite a while ago for some sciatica. We got rid of the sciatica relatively quickly, and she is an Energizer bunny. She takes care of a big house, small farm, travels, grandkids, neighbor kids. She's doing all sorts of really cool things. Recently she came back to me for some chronic shoulder problem. She's got some severe arthritis, scheduled actually for shoulder replacement surgery, and she wanted a little relief because the orthopedist couldn't get to her for a couple months. So Ann, if you could share with the folks out there a little bit about your shoulder and what you felt before you started seeing me for your shoulder trouble.
Well, when I first came in, I had been here first for my sciatica. And you took care of that amazingly. And so when my shoulder started freezing up and I couldn't get immediate care for two reasons. One, because the operation schedule, but two, more vainly, because I wanted to take a trip with my husband. I figured maybe Dr. D would be able to alleviate some of my pain. When I came in, I was not able to lift my arm really past my elbow. I would sit there crying some evenings because of how bad the pain was. I have a bone-on-bone with a huge bone spur. The solution originally was steroids, but I can't do that 3 months prior to the surgery. So I was looking for something that would help alleviate the pain, and Dr. D stepped in and explained what his program was. What is it again called?
Okay, we start out with chiropractic.
Yeah. The chiropractic, which was wonderful.
And that and the manual therapy got you about 50% of your range of motion back within 3 weeks.
If that, 3 weeks.
2 weeks.
And after that, we kind of progressed because I wanted more. And I wanted more. And also because I was really getting hooked more on this type of
natural therapy versus
medical therapy. The more you read about steroid shots, the more concerned I became. So we started this program.
And this is called, it's called RPW, or Radial Pulse Wave Therapy with high intensity cold laser, which is a physical therapy grade laser. And what it does is it kind of knocks all the rust off of the joint, or shakes the calcium deposits up a little bit. This is a less intense version of the same kind of therapy that urologists use ultrasound to blow up kidney stones with. We don't need anything that strong to treat a shoulder arthritic or a knee arthritic kind of problem. And so we're doing radial pulse wave therapy, followed up with my personal touch is nutrition support and high intensity cold laser to activate the DNA to speed up healing. In other words, get the arm feeling better as quick as possible. The whole program is 6 weeks, and we're only in our 2nd week, and you're feeling even above as good as chiropractic was. You're feeling even better now, right?
Oh, it's amazing. Quite honestly, after the first treatment, and I kept thinking, was it mind over matter? And it wasn't. After the first treatment, I was able to move my arm. I was able to sleep more than 3 hours.
Yeah, so because you couldn't sleep on your side,
I couldn't sleep
right?
on my side. That was the other thing. I can now sleep on a side. Try sleeping on your back if you're not a back sleeper.
And tell the people what you did just last weekend.
Well, I've been critiqued here for that this morning. But this past Saturday, I got up and I felt really good, and I figured enough of this. I'm going to go ahead and try out my new carpet cleaner. So I cleaned 4 carpets. 8 by 12 carpets, no problem. Went out on the deck, saw the deck didn't look too good, so I wound up power washing the back of the deck. And I could never have done, I was lucky I was washing dishes before I started this program. So I'm very hooked on it.
So that is awesome. So anything you would like to say to the folks out there that are having chronic knee pain or shoulder pain, are told they need a joint replacement or a cortisone shot to fix it, about chiropractic or Dr. D's RPW program?
I recommend you look into it first. Just look into it first. Even if you're going to wind up having shoulder surgery, which I will eventually do because I've seen the x-rays and I know. But rather than rush into it, I would recommend this, not only, it's almost preparing me for the next stage. When I have the surgery, I don't want to be laid up for what they're telling me.
You want to recover quickly.
I want to recover quickly, and I can find that here. I can sense that here. And I've started the nutrition, and I find that it helps you mentally as well, because you feel you're becoming strong again.
Exactly.
And I think that's the main thing. I feel I'm strong. I know I still have the bone spur. I know I still have bone on bone. But I also know
you can use your arm now.
I can use my arm. I can be strong again with it. That even when I go into the surgery, I'm not going to go in on a weaker point.
You're going to be stronger,
ready to rehab.
Exactly. And that is just the key kind of thing. Anyone considering surgery, in the end, you know, when you're over 50, 60 years old, joint replacement may be in your future. Our RPW program might buy you a couple of years. You might avoid a cortisone shot, which may or may not be good for you, depending on how you respond to those kind of treatments. Chiropractic maybe has only taken you so far, but bone on bone is bone on bone. Even getting chiropractic adjustments is going to have its limits. So doing a nutritional support program with this new modern radial pulse wave therapy and the cold laser combination, we're getting amazing results. This is actually very common in my practice right now. So, Anne, I want to thank you for sharing. Is it okay if I share this on Facebook or YouTube?
Yes, absolutely. Yes, I highly recommend it. I mean, it gives you a peace of mind. I like coming here because I found, you know, I feel that all too often in the medical world you become a cog in the wheel. And I have to say I appreciate the one-on-one, the time you take to explain to me, because I'm one of those, I'm not a good patient. Anyone who knows me will tell you I'm not a good patient.
Yeah, I am a little slower. I'd spend some time with my patients.
And I appreciate that.
Well, excellent, excellent. Thank you very much, Anne. I appreciate you sharing this with everyone out there. And everybody, if you have any questions, just look at the information that's appearing underneath the video here. And if I can help you, give us a call, or if I can find a referral for you in another town where you're at, I'd be more than happy to help you do that too. So have a great day, everyone.